Hey guys, this is Dr. Hub. Today we'll look at the mosquito. So the mosquito, we are discussing it as a vector. The mosquitoes, they are global. It's found globally in distribution. The main species of mosquitoes, it includes, there is Anopheles, then NCLEX, Aedes, as well as Mansonia. So the flight range, it varies up to 11 kilometers. Flight range is going to be 11 kilometers and except Aedes, for which is 100 meters. So in terms of Aedes, it's going to be 100 meters. The lifespan of mosquito is going to be 8 to 34 days. So lifespan of the mosquito, it will be 8 to 34 days. So their morphology, it consists of a head with proboscis. So the morphology of the head, it contains the proboscis, and there is a pair of palpi, Next is a pair of antennae, There is a thorax and an abdomen as well. There is presence of thorax as well as there is abdomen. So next, there is also a larval stage. So there is a larval stage. So it lasts for about 5 to 7 days. Now let's break down to the common variety. First, we will be discussing the Anopheles. So the Anopheles, the eggs. So eggs approximately 100 to 150, 250. This is present in most of them. So in Anopheles, it is laid singly. And boat-shaped with lateral folds. Anopheles is boat-shaped with lateral folds. Next, we move on to the larval stage. So larval stage, there is no siphon tube. Then it lies parallel to the undersurface of water. Next, we look at adults. What is happening in terms of adults? So in terms of adults, it will be the wings are spotted. This is all in case of Anopheles. And what about the breeding areas? So breeding areas, it has clean water. What about diseases? Diseases includes, there is malaria as well as there is filaria. Now let's look at some other points. The Anopheles mosquitoes, these are some important points. The Anopheles mosquito, it tends to sit with their heads low. So the heads are low and their rear ends are raised higher. So the rear ends, they are high. And especially when feeding. So this especially during feeding. Then we move on to the NCLEX. As per the NCLEX, the eggs, they are laid in clusters or in rafts. So what about the larval stage? So in case of the larval stage, it has a siphon tube. So NCLEX has a siphon tube. Next is, it lies in water with head face downwards. So it lies in water and then the head, if you see, it faces downwards. The head is facing downwards. Now, what about the adults? The adults, the wings are unspotted. Then talking about the breeding areas, it is going to be the dirty as well as polluted water will have NCLEX. Now, what diseases are transmitted? So in terms of Anopheles, it was malaria and filaria, whereas in case of NCLEX, the diseases, it includes, there is a Bancrofton, there is a Bancroftian, filariasis, then comes the Japanese encephalitis, and there is also the West Nile fever. West Nile fever. Then comes the viral arthritis. Now let's see some important comments. So this is called as nuisance mosquito. These, the culicine female mosquitoes, the culicine female mosquitoes, they keep their body horizontal while feeding. They keep body horizontal. This is why feeding. Lastly, we are moving on to the Aedes mosquito. In terms of Aedes mosquito, the eggs, it is laid singly. Now, what about the larval stage? Under the larval stage, it has a siphon tube, and it lies in the water with head faced downwards. So it lies in water and the head is faced downwards. Then comes the adults. The wings are unspotted and it is a striped body. Striped body. Then let's look at the breeding areas. Breeding areas, it includes, there is artificial collections of water. Then comes the diseases. Aedes disease, Aedes, it causes diseases such as yellow fever. There is dengue, DHF, chikungunya. There is also the Rift Valley fever and filariasis, as well as presence of the Zika virus. Now let's have a look at some comments. There are also known as the tiger mosquitoes, and they are day biters. They get the tigers' names from the white tiger stripes on leg. So they are tiger because of the white stripes. White stripe on the leg. It is very significant. Then we have the Mansonia. So let's look at Mansonia. So under Mansonia, it is laid in the star-shaped clusters. So it is laid in star-shaped clusters. So how is the body? The larval stage, it includes a siphon tube. So it has a siphon tube. Next is it lies in water with the head face downwards. So it lies in water, and the head, if you see, it is downward. It is downward. Then looking at adults, the wings are unspotted. The wings are unspotted, but it is spotted in case of Anopheles. Wings are unspotted. Then let's look at the breeding sites. Breeding site is that there are water bodies containing aquatic vegetation. So in terms of water bodies with aquatic vegetation. Next, we will move on to the diseases. The diseases which are caused include Malayan filariasis. So it is a Malayan filariasis. So what are some important points to note is that it is a big black brown mosquito. It is a big black brown mosquito and with sparkling legs and wings. So they have sparkling legs as well as wings. So let's look at some important points to identify a mosquito. So if you look at NCLEX, it keeps their body horizontal while feeding. So keeps body horizontal while feeding. Then we will look at the Anopheles mosquito. Anopheles mosquito, it tends to sit at an angle. So it sits at angle and they are with their heads low and the rear ends raised high. So their heads, if you see, they are low and the rear end is high. Lastly, we need to know that the Aedes mosquito, it has a striped body pattern. So this is nothing but looks like that of a tiger stripe appearance. There is a striped body pattern.